Welcome. Good morning, good evening, and good afternoon. Thank you to those joining us live in our event and to those who will be listening to us afterwards. We're very, very pleased that you've joined us for this special event on pandemic preparedness, pharmacy's global responses to the COVID-19 pandemic. My name is Lina Badr. I'm the FIP lead for Equity, Sustainability, Policy and Development. And together with my colleagues who you'll be hearing from today, we've all led the work that will see the launch of the report, which we're hosting this special event on. So we are very excited to be sharing with you our latest piece of work as part of our pandemic preparedness program at FIP. More on that in a moment. So first, let me start with some quick housekeeping announcement. This webinar is being recorded and live streamed via YouTube. The recording will be available on our website, events.fip.org, which will also be the repository for the recording of the event and all other events we host. You may feel free to please ask questions, but do use the question box provided in the Zoom bar at the bottom of your screen. We will be able to pick them up either via chat or live. You are welcome to provide feedback on our events and webinars to webinars@fip.org. And if you aren't already a member, please feel free to explore our membership benefits and hopefully decide to become a member of FIP. A very quick reminder of the event features of today, really important for us. The event is not only focused on pandemic preparedness and response, but also primary healthcare in the context of resilient health systems. So you'll hear from my colleague Milhan today, a full briefing on the FIP Primary Healthcare World Map, which launched just earlier this week. We will, together with you, launch the new FIP report on pharmacy's response to COVID-19. We will also hear from a global panel of more than 10 country leaders to share their pandemic response practices and lessons for everyone, for the profession worldwide. Oh, sorry. Just very quickly, I wanted to frame this discussion and the program. This project we're launching today has been delivered as part of the FIP Sustainability RX program, which is the program of work that supports the implementation of FIP Development Goal number 21, Sustainability in Pharmacy, which covers not only environmental and planetary health issues or the angle of sustainable services, but importantly, as you see in number 1 on the screen, responding to disasters and pandemics. This is a very important area of sustainable services in pharmacy, and we're very pleased to be delivering the work to you today. You can find out everything about the Sustainability RX program through our microsite, the special microsite for this program, sustainability.fip.org. Please feel free to explore that and let us know if you have any questions or would like to be a part of the work. So our learning objectives is to understand how FIP supported our members through the pandemic and how we continue to do that, how pharmacy leadership around the world, pharmacy leadership bodies responded to the pandemic as well. We want to discuss and showcase country best practices, initiatives and lessons that can inform future pandemic preparedness, response and recovery, and learn about FIP's map of primary healthcare, a reminder of why it's very important to strengthen health systems and recovery through pharmacy. I'd like to begin by welcoming our FIP Chief Executive Officer, Dr. Catherine Duggan, who's with us today to provide the opening speech for this event. Catherine, welcome. Thank you so much for joining us.
Thank you, Lina, and we'll do some thanks and acknowledgements at the end, but I think really it's testament to you and the rest of the team who've been working on this, but probably primarily thanks so much to our member organisations who inspired us during the last months. So Lina and colleagues, one of the imperatives for organisations like FIP is to respond during uncertain times, to continue to steer and support and represent our profession, as well as to lead and support our member organisations worldwide. And That includes for us our members, our observers, our academic institutions, and our scientific member organisations. It's really important that we do that in a continuous, trusting way. The COVID pandemic has taught us to learn to adapt to the circumstances the world puts us in, not only as an organisation, but as a profession, as an entirety and a whole. FIP recognises not only the importance of developing the profession with you, for you, on behalf of you, but also the complexity of balancing the delivery of the present, emergent and urgent needs with future goals. It's not enough for us to set a strategy and sit back and wait for times to be right. We have to face the situations that are in front of us, while trying our best to harness the opportunities presented from these difficulties, trying to see the silver lining. For all of us, it's hard to remember the early days of the pandemic, both personally and professionally, for so many reasons. Many people have lost colleagues or friends, or just found themselves quite traumatized with things that they have experienced, or because the months go by and it feels like we lost time together. It's hard to think back that this is so many months. It's important for FIP to spend a moment in time to mark the journey through the past 30 plus months of our shared experiences, to afford you a time and a space to take a moment to reflect on the brilliance of your work. As we pass the 1000th day since the World Health Organization, the WHO, declared the COVID-19 outbreak as a public health emergency on the 30th of January 2020, we take the opportunity to mark this event and present this global report of pharmacy's response to the COVID pandemic. This same week, as Lena mentioned, we mark the 4th anniversary since the Astana Declaration, where we all came together in 2018 to endorse the new Declaration of Astana, emphasising the critical role of primary healthcare and for FIP to assert our position therein. Today, we will also learn about our response to COVID, discuss the importance of resilient pharmacy and health systems. Just remember back, colleagues, in 2018, we were talking about the challenges that primary healthcare presented the globe and our place in it. And since then, we've gone through this massive pandemic together. So it's important that we provide you with a briefing on the FIP Primary Healthcare World Map, which we launched earlier this week. What a week. The Pandemic Response Report, which we're launching today, will inform and partner our forthcoming report to support preparedness for future pandemics. Colleagues, it's important, whilst we plan for the future, we take stock of where we are and what we've learned. As I mentioned, so much of what we've learned, we have probably already forgotten. So supporting our members through the COVID pandemic quickly became a core priority for FIP. And I may say it's still a priority amongst others now. The report describes the key pillars that underpinned our own response and how we navigated to continue to serve our members. Indeed, for me, as CEO, reflecting on everything we did made me proud to think that many of the ways we supported our members are fundamental to why we are here. We had to support international solidarity and you, our members. We had to advocate and showcase the impact of pharmacy profession in responding to the pandemic. We had to gather data, evidence and innovation and provide new ways of sharing this as things changed, not only on a monthly basis, but sometimes daily and definitely weekly. We had to adapt our business and our ways of working, and I know all our members did as well. In addition to our own response, we strove to understand the response from our pharmacy leadership bodies to your nation's needs. The report describes the response from a sample of organisations and in-depth studies of selected initiatives. The report serves as a repository and a tool, taking stock, reflecting and shining a light on the continued and changing response over the period of 1,000 days. We have divided that into 10 blocks of 100 days to showcase the professions and our members' commitment to patients and the public. Really, colleagues, without you, I don't know where we would have been in the pandemic, and we know that pharmacy's contribution from science, from education and practice has been second to none. So we want to share practices and responses from around the world to inform the response and future preparedness. As we work our way out of the pandemic, we at FIP will provide more tools and guidance to you, our members, on better future responses, although we've done pretty well so far. What we want to do now is to think about better ways to be prepared and continued recovery. We're listening. and over to you for the rest of the presentation. Thank you so much, Lina. Thanks for the opportunity, and I'll join you again later.
Thank you very much for that, Catherine, for setting the context, but also describing to everyone the strategic imperative behind this work and how it fits with all of what we're doing. I'm going to be moving us along. There's a lot to share with you today. So very excitedly now, I want to introduce my colleague Nilhan Uzman, who's going to be providing us with a briefing on the FIP Primary Healthcare World Map, which is newly launched. Nilhan is the FIP lead for education and primary healthcare policies. Nilhan, the floor is yours.
Thank you, Lina. Hello, colleagues. Good morning, good afternoon, good evening to everybody. So today I'll be providing you an overview of the FIP Primary Healthcare Roadmap that we have launched earlier this week. So next slide, please. So as Catherine has mentioned in her opening speech, this week hosts two important milestones for FIP, one of which is this special event on pandemic preparedness, where we showcase pharmacies, your responses to the COVID-19 pandemic. The second important milestone was that earlier this week, on 25th of October, FIP celebrated the 4th anniversary of its commitment to the World Health Organization and United Nations Declaration of Astana on primary healthcare. Pharmacies have been, in some cases, the only accessible private providers of primary healthcare throughout the pandemic. And FIP would like to support global pharmacy in its preparedness to other pandemics or other crises that we might face through strengthening primary healthcare. So we were proud to mark this 4th anniversary on 25th of October by launching the FIP Primary Healthcare World Map. The FIP Primary Healthcare World Map showcases 50 country examples on primary healthcare delivered by pharmacists from 27 countries on 27 different primary healthcare topics. Here, I would like to thank all of our colleagues, our members who have contributed to our world map. Each primary healthcare country example is mapped to WHO's primary healthcare measurement framework and indicators, which you see on the screen, which was also launched this year. This framework, developed by WHO, aims to monitor health systems through a primary healthcare lens, and it measures progress towards achieving the goals set in the Astana Declaration. So this has been a very useful tool to us. And as we speak in the language of FIP development goals, the important thing is that we have mapped this framework to our FIP development goals as well, so that we can speak in the language of pharmacy for primary healthcare. Next slide, please. Can we go to the next slide? Yes, thank you. So the FIP Primary Healthcare Roadmap is a visualization tool under the FIP Global Pharmaceutical Observatory Atlas. And I would like to take this opportunity to thank my colleague, Dr. Aysu Selçuk, for her hard work on providing this world map to you, and also our colleagues, Christopher John and Dr. Shirley Melianti from the FIP GPO team for their support with the visualization tool. So I'm going to do a short demo on how you can use this tool. So I kindly ask my colleague to start the video so I can explain you how you can use this tool and what you can find in it. Could we start the video, please? Yes, thank you. Thank you very much. This is on our FIP microsite on primary healthcare, which my colleague has shared the link to you. So as you can see, this is visualization tool, a world map, basically, that has all the indicators that are relevant to primary healthcare from the framework mapped with FIP development goals. You will have access to different indicators, and basically you can explore different indicators, and then if you can have a full screen overview, you can see all different indicators that we covered through counter case examples in this world map. For example, you have access to different regions. If you would like to specifically focus on your region or on other regions of the world, you can select the region that you would like to explore specifically, and then you can also search for a country and see what kind of indicators and primary healthcare initiatives that are available. Each indicator is, or each counter case example is linked to a video on YouTube. So when you click It's going to take you to YouTube to watch and explore different case studies, one of which is our colleagues from Royal Dutch Pharmacists Association from the Netherlands. And basically, the tool will allow you to raise your selection so you can further explore different case studies through there. All the lists, if you don't want to specifically select an indicator, if you'd like to explore them all, simply scroll down, and then the list below will have all the indicators, counterexamples, their titles listed, and basically the link on the right-hand side will take you to the different case studies, so you can watch as interviews. You can also search for specific keywords among the indicators. For example, if workforce is one of the area that you would like to focus on primary healthcare, simply type workforce in the indicators section, and then it's going to take you to education and workforce related case studies on primary healthcare. This one is from our colleagues from the United States. You can basically also remove your selection and have full access to different indicators. So it is my pleasure to introduce this tool for you, and I hope you'll find it interesting. So we can go to the next slide. Thank you very much. So the counterexamples are intended for professional organizations, universities, pharmacists. You can adopt and adapt these case studies in your own countries. It explains which primary healthcare it has tried to address, what were the outcomes or expected outcomes, the lessons learned, and what further developments that pharmacists should make in that specific country. So it's going to explain you these answers. And while all country examples are linked to primary healthcare and pandemic response in some way, Spain, Romania, Thailand, and Lebanon's country examples are directly linked to COVID-19. So you can go to the world map and explore these specific case studies on the COVID-19 pandemic. I invite you all to explore our world map, share the tool across your network and social media platforms. If you have any questions or you would like to submit an example from your country on primary healthcare, please contact FIP at phc@fip.org. And that's basically all. So now I'm going to hand over to the FIP Chair of Board of Pharmaceutical Practice, Darragh Connolly from Ireland, who will deliver his message on primary healthcare, how primary healthcare interventions led by pharmacists can support health systems recovery post-COVID-19 pandemic. He is unable to join us today. He's sending his apologies, but he has a specific message for you to link primary healthcare with the pandemic preparedness. So that's all from me. Now I'll hand over to Darragh. Thank you very much. Could we play the video, please?
Yes, I'm sure the video will be played shortly. Thank you so much, Nilhan, for that fantastic introduction. A great piece of work, testament to the impact of pharmacists on primary healthcare, universal health coverage. Thank you so much. And here we will hear from Darragh.
My dear friends and colleagues, I hope this message finds you well. It is an honor to join you today as we reflect on pandemic preparedness and the response of pharmacy and pharmaceutical scientists to the COVID-19 pandemic. I start by apologizing that I can't join you in person today because I am carrying out very important work in my community pharmacy in my small town, because I'm running a vaccination clinic and we will be vaccinating people against seasonal influenza and also against the latest strain of Omicron using the newest version of the Comirnaty vaccine in my community pharmacy. We are 1,000 days since the notification of the outbreak of a global pandemic named COVID-19 by the WHO in January of 2020. And I reflect back to my own practice as a pharmacist as we learned the pandemic was affecting our friends and our colleagues in China, and then as it spread around the world, and how fast things happened and how little we knew. We know an awful lot more now, and I think it's a really good idea that we reflect on the role that pharmacy has played in stopping the spread of COVID-19, and also teasing out how pharmacists, through whatever role setting they work in, were able to really benefit the communities they serve and the society that they serve by using their pharmaceutical knowledge, by using their scope of practice, but also using their network and their connectivity to the societies that they serve and the communities that they serve. Most importantly, I have learned through my involvement with FIP that the preparedness that we had was based on nobody had predicted that the COVID-19 pandemic would happen. We were aware that pandemics do happen, and we had warnings through SARS and we had warnings through swine flu. So to make it a little bit more local than global, when I see my experience in working in pharmacy advocacy here in Ireland, we went to our government as pharmacists and said, we are not prepared for an outbreak of avian flu or an outbreak of swine flu, because the time it would take to vaccinate the population would be too slow if we were just to use people who currently vaccinate. And in the meantime, while we are training pharmacists to be able to vaccinate in that circumstance, we can do an awful lot of good for people if we could vaccinate against seasonal influenza. That, colleagues, was the basis of how we were able to really contribute to the fight against COVID-19 in Ireland, because we had the basis of 7 or 8 years experience of vaccinating in community pharmacies in Ireland against seasonal influenza, which gave us the scope of practice and the reach and the accessibility that was needed. And I think what we showed in Ireland was that we had the ability to get our numbers up to the middle to high 90s of people vaccinated, because we had the reach and we had the access. This would bring me to the point, and I know it's going to be really topical in the conversation today, about the role of pharmacists in primary healthcare. And I know that, having spoken to lots of colleagues at our World Congress in Seville, I ask colleagues maybe to think about things a little bit differently, and as they, in their own practice setting, should encourage people who are involved in policy around healthcare and the delivery of healthcare, which is of patient choice, patient-centered, but it's also timely, appropriate, and delivers good value. I think it's incumbent on us to advocate that instead of looking at it that pharmacy must be involved in primary healthcare, it's that primary healthcare needs to be more involved in community pharmacy and who we are and what we do. I think there are lots of tools out there to help us. I think mainly digital health is absolutely fascinating, and what we can do to integrate our digital healthcare records. But I think probably most importantly, which was the title of the information that we brought forward from the Republic of Ireland, which is to say that pharmacy is the open door to healthcare. And I think probably the most important lesson that we have learned is people trust their community pharmacists. They trust the teams that we lead, and the accessibility and is very, very welcoming to those people that it can be difficult to reach. So, colleagues, my dear friends and colleagues, I hope this
I'd like to thank my colleague Nilhan for that wonderful description and briefing on the FIP Primary Healthcare Roadmap, followed by our colleague Derek from the Board of Pharmaceutical Practice. And that was really, really important. And I think it frames the discussion of today, because pandemic response and preparedness is only one important part of a resilient and healthy primary healthcare system empowered by pharmacies. I'm very pleased to move us along to the official launch of the new FIP report, which we will brief you on shortly. The report is titled "The Global Response of Pharmacy to the Pandemic: the contribution of the profession to COVID-19. On the slide here, you see the cover of the report. There's a QR code that you can scan from your seat to access the report, and my colleagues will drop in the link to the report so you can read it in your own time. What we will be doing for the remainder of the event is sharing some of the key outputs of the report with a feature on some live examples from our member organizations who are with us here today. I want to very briefly run through the key contents of the report. So the report is around 70 pages, so very comprehensive, but focuses on two main aspects. So what we mean by the global response to the pandemic is both FIP's own response as an organization, and how we supported our members through the pandemic. So we've described that in detail, and we'll be providing a high-level overview of this in this event. And importantly also, we have gathered data from member organizations around the world to better understand their own response to COVID-19, especially across the first 1,000 days of the pandemic. So these included the detailed results of the global survey on pharmacies' response to the pandemic, which we'll also run you through later. But we've also gathered some case studies, more in-depth case studies on leadership strategies and initiatives from selected member organizations. I'm very pleased that we have 10 member organizations across all 6 regions with us here live today. And we will go through to a panel discussion with them, a panel description with them to hear about their leadership strategies and initiatives. For this section of the event, I'm going to be asking my colleagues to switch to the slides for those sections and asking Farah to come on the screen, who I'll be introducing shortly. Farah, the floor is yours.
Thank you so much, Lina. Hello, everyone, and welcome again to today's event. My name is Farah Haqqad. I'm FIP's Regional Engagement Support and Development Manager. As Lina presented, throughout this project, we sought to understand not only FIP's global response to the pandemic, but also the response of pharmacy leadership bodies, our member organizations, to the needs of their countries. An in-depth case study of selected initiatives is provided in the report in part 2. And as part of this section, we will hear about some member organizations' leadership strategies and initiatives. Today, in this event, we have a number of speakers and representatives from these leadership organizations from around the world who will present a brief overview of these case studies. So before I welcome our speakers, I just want to say that we would really like to hear from you as well, and we would like to include your voice in the conversation. So please feel free to ask questions, share your comments, tell us how pharmacists responded to the pandemic in your country. And please let us know in the chat box if you have any questions. Or actually use the Q&A box in order to ask your questions during this part of the program so that our speakers can address these as we go through the event. In the time we have available, and to do them justice, we will not cover the detailed biographies of our speakers, but I encourage you to refer to the biographies document that was shared in the chat box for more information. So first, if we can move to the first slide, we have many initiatives undertaken by our colleagues in South Africa, including online webinars. It's a pleasure to invite Mariette Eckstein, the Professional Development and Support Officer at the Pharmaceutical Society of South Africa, who will elaborate on these initiatives. Mariette, the floor is yours.
Good afternoon, Farah, and good day, all colleagues. And thank you for joining us today at this very important milestone event. And as Catherine has also said in her opening remarks, that it's a day that we shouldn't forget what happened 1,000 days ago, because back then, if we can recall the fears and the uncertainty, it definitely impacted on our lives as well as the lives of our patients. So Farah, as you've mentioned, I just quickly want to elaborate on maybe 3 items that I think from the point of view of the Pharmaceutical Society of South Africa that really changed the way we do things and that was impacted by the global pandemic. And the first one, as you've mentioned already, is the use of online webinars to connect and inform our members. So even before the pandemic, the PSSI had a obstacle that we were not able to connect with our members in all corners of South Africa. And one way of overcoming it was to implement a GoToWebinar platform already in 2007. But as you can see there from the pre-COVID-19 statistics, that between 2017 and March 2020, we only offered 4 webinars. You can see the average registration per webinar was only 107 and only 58 people attended an webinar on average. So the appetite and maybe the transformation to the digital arena wasn't there already. And then came COVID, which really transformed and accelerated that tremendously. And from March 2020 until today, we've offered 53 events. We have an average registration of 222 and an average attendance of 134 members. We've also invited for certain webinars our neighboring countries and invite their members as well. In other words, the Pharmaceutical Society of Namibia, Zimbabwe, Lesotho, and Eswatini. And we thought that their members could also benefit maybe from the events that we have in South Africa. So the benefit to our member is that now we can reach all members, whether you are in the rural corners of our country, with the same benefit as someone living in an urban area. And we are able now to connect experts, world experts, to local pharmacists without a massive cost. That wasn't always possible. And there on the 2 graphs, you can just see an indication of the layout and the distribution of the attendance to our webinars. If I can use the second example on the following slide, it's a single case at one of our South African universities, the university, Rhodes University, where you can move to the next slide, where they, for instance, realized the moment we went into the pandemic and there was this shortage of alcohol-based hand rub, after the WHO recommended that that should be preferred as routine hand hygiene in healthcare settings, that there was definitely a shortage, as we all know, and those type of resources also came with a cost. So then Rhodes University partnered with the Department of Health, local communities, students and other role players to set up a small-scale hand sanitizer manufacturing plant in the sterile products laboratory at the pharmacy faculty at Rhodes University. And this was under the leadership of our colleague and fellow of the PSSA, Prof. Rod Walker. Obviously, this is not an easy decision. It's not simple to start with it. And if you have the opportunity to engage with Prof. Walker, he will take you through the trial and errors that they had to do to get the system running. And there was different factors like where the need is, what resources to use, the processes, and how they're going to distribute it. But during that time, they were able to manufacture 14,500 liters of sanitizer, which was equal to 14 million hands being sanitized. And this was distributed throughout the province where they find themselves, to local clinics, local organization, government facilities, etc. Also, was there a knowledge transfer to some of the agricultural research institutes where they came to learn the skills and they could also set it forward. Definitely a very proud moment for this university and for South Africa. And then lastly, as we've also discussed at the FIP Congress in Seville, to some extent, was the accessibility and availability of vaccines, especially maybe to our middle and lower income countries. You can move to the next slide. And this was also experienced in the South African environment. The sad part is that initially our government was convinced that they will attempt this national vaccination in South Africa without including pharmacists as part of their plan, or without including community pharmacies in their plan. So we've noticed this when pharmacists were not able to register for the compulsory vaccinators training. So it took some interaction with the government to explain to them firstly that community pharmacies is situated across the country, and they're all corners of the country, rural, peri-rural and urban areas. and that pharmacists in South Africa has existing vaccination rights as per our competency standards and our scope of practice. So the result is that the government did engage with us, they did allow us. So this added 1,458 private sector vaccination sites that was accessible to both private and public sector patients on equal grounds. And each site had at least one pharmacist or nurse vaccinator. So indeed, without the role of the pharmacist, I think we would have still been busy vaccinating the first injection of COVID-19 to our public. And lastly, what is also an important movement for South Africa is that due to this vaccine inequities and the trouble we had to secure vaccines in South Africa, this led to our manufacturing sites in South Africa adopting and changing, so that first they could only full multi-dose vaccines, but now we're also moving into a process of local manufacturing of COVID-19 vaccines. So indeed, this is moving us forward. This is taking South Africa and the pharmaceutical healthcare sector forward, and indeed a very proud moment for us. Thank you, Farah, and thank you, colleagues.
Thank you for the great presentation, Marriott. We really appreciate how pharmacists in South Africa participated and engaged together with the government in order to showcase the impact of pharmaceutical services. And we are proud of the Pharmaceutical Society of South Africa. So moving from South Africa, we will now explore a key initiative from Portugal. And I'm pleased to introduce Teresa Almeida, member of the Board of Directors at the National Association of Pharmacies. Teresa will discuss the association's action and COVID-19 testing in pharmacies, particularly the pharmaceutical service of rapid antigen testing for the professional use, the point of care. Teresa, over to you.
Thank you so much. So I'm Teresa Almeida. I'm a member of the board of ANF, and I'm also a community pharmacist. So I will speak a little about ANF action and COVID testing in pharmacies. First of all, thank you so much for inviting us to speak about our experience in Portugal. And starting with COVID testing in pharmacies, in Portugal, we have pharmaceutical service of rapid antigen testing in community pharmacies with NHS referral, and it was a service that was paid. It was very important, this aspect. So in October 2020, the Portuguese government included the rapid antigen test in the country's national strategy for detecting COVID-19. Community pharmacies were authorized to perform testing and provide this service to the population. This initiative enabled the integration of community pharmacies in the national system for epidemiological surveillance and into the referral communication system used by our NHS. So, the ability to provide antigen rapid tests significantly strengthens the country's testing capacity, providing that community pharmacies have been fundamental in the fight against the pandemic in the country. Together with other measures adopted during the most critical phases of pandemics, it demonstrated once again that the inclusion of pharmacies through the existing and well-trained workforce in all regions of the country is a resource that the health system cannot afford to waste. The results of this initiative show that pharmacies make it possible to fill geographic and socioeconomic gaps in the coverage of national territory. Next slide, please.
Teresa, may I just remind you if it's possible for you to open your camera? Because we can't.
Yes, thank you. It's okay right now? So,
yes, we can see you.
Thank you so much. I was not sure if it was interrupting anything in the internet, sorry. So I was so concentrated, sorry. So the results of this initiative show that pharmacies make it possible to fill geographic and socioeconomic gaps in the coverage of the national territory. Without pharmacies, the provision of this service in population would have covered the mainland with significant gaps, further increasing inequalities and in already most vulnerable groups of the population. I think this was common in all over the world. And the remuneration for this pharmaceutical service was provided by the national healthcare budgets and from municipalities. This is also very important. So can I ask next slide, please? So this shows our country. We are a small country, and in green, we have all pharmacies spreading all around our countries. You can see that is very well spread. We have a very good pharmaceutical coverage. In orange, we have labs, and in little green, light green, we have other entities. In Portugal, for instance, dental clinics have an exceptional authorization to perform tests also. And the last map on the right side, it shows all together, and this shows how important pharmacies were and the role that took place in covering all our country for testing. And now I will speak a little about how ANF helped pharmacies' response to COVID-19 in Portugal. So, developing, updating, and technical and professional information to train and support pharmacies' intervention in contingency plans to ensure pharmacies' continuous activity. Promoting new projects to assure access to medicines and vaccination with other organizations, government, hospitals, healthcare professionals, NGOs, and others. Establishing an emergency fund to help citizens that due to the COVID-19 pandemic have specific needs in their access to medicines, health products, and services. Advocating for the renewal of the electronic prescription of medicines by pharmacists during the state of emergency by the pandemic-19 COVID. Collaborating with Portuguese government and public health authorities to develop guidance on the COVID national response, and set up a pool of volunteers, pharmacy students, and early career professionals to help pharmacies. Creating new communication channels between pharmacists and patients, direct phone line 1400. Dispensing specialty medicines, which could be dispensed in community pharmacies and or be home delivered, avoiding patients from going to a hospital. Next slide, please. And partnering with national health services and municipalities to provide free COVID-19 antigen rapid tests point of care in pharmacies. Thank you so much, and it was a great pleasure to be here with all of you colleagues. Hope to see you soon. Thank you.
Thank you so much for the excellent presentation, Teresa. It's inspiring to hear about the efforts of pharmacists in Portugal, and we will build on these initiatives later on with another member organization from Portugal as well. But at this moment, I will move us forward to the next speaker, Professor Sofia Segura Canu from the University of Costa Rica, who's also a collaborator with the College of Pharmacists of Costa Rica. Sofia's presentation will focus on adapting a pharmaceutical service project for immunization. This project started in January 2020, and many of its activities were modified to respond to the pandemic. So let's hear more about it. Sofia, the floor is yours.
Thank you very much, Farah, and good morning, good afternoon, and good evening to everyone. In the next slide, I would like to talk a little about Costa Rica, because I know that we are a small country located in Central America. Actually, we are a country of 5 million people. And I would like to say that because today I'm going to talk a little more about Colegio de Farmacéuticos de Costa Rica, or College of Pharmacists of Costa Rica. From now on, I'm going to call it COLFAR. It has been working since 1902, and I have to say that it's the Pharmaceutical National Organization in Costa Rica. And it has two main functions that I think that are the key points to understand the response from the pandemic. The first one is that COLFAR has the responsibility to authorize all the pharmaceutical establishments to obtain the operating license. And the second one is that COLFAR oversees the inspection of pharmaceutical establishments. And to understand now, what did COLFAR do during COVID-19? I have to say that these two characteristics were crucial to understand the things that the organization did. The strategy was classified into four main categories. The first one was a political strategy. The second one, a media strategy. The third one, pharmacy practice strategy. And the fourth one, administrative strategy. So in the next slide, I am going to talk a little more about each one. The first one, political strategy. COLFAR has a strong cooperation with the Ministry of Health and other stakeholders. And this allows us to the development of technical guidelines to respond to the pandemic. And in the second strategy, media strategy, we have developed a repository of COVID-19 in our webpage. This was for the pharmacists. And also, we have made some information campaigns as I am going to talk in just a few seconds. And the third thing is that we have made some technical scientific information to provide effective responses from the pharmacists and the community pharmacies. The third strategy was pharmacy practice. And I have to say that during the pandemic, there has been some ad hoc efforts to ensure that pharmacists had procedures, supplies, personal protective measures, guidelines, continuing education and technological tools to deal with the pandemic. This was very important for all our colleagues. And the fourth strategy was administrative. And this was related to the virtualization, mainly the virtualization of some procedures that before the pandemic were made face-to-face. So with the virtualization, some procedures get better, even get better. And as Farah said, in the next slide, I am going to talk about a specific project. This project started in January 2020. Well, I don't know. Well, I know that you all remember that in January 2020, the pandemic was beginning. And we started this project without knowing that we were going to work with the pandemic. This project is called Development of Pharmaceutical Services in Immunization from Community Pharmacies. We developed this project because in Costa Rica, we can indicate and administer vaccines in community pharmacies. And when we started with the first objective that you can see there, that was carry out information and education campaigns aimed at the population on the importance of vaccination. But with the pandemic, we have to develop more resources to face the misinformation related with the pandemic and related with the myths related to the vaccines. And I would like to, I just have 5 minutes, but I would like to say that we have developed 3 main campaigns related to these objectives. One of them was specifically for COVID-19. The second one was related to influenza vaccine, and the third one was related to the pediatric vaccination. Also, within this project, the second objective was related to develop a training program on pharmaceutical services in immunization for pharmacists. And this has been very important, and we are still in progress of the accomplishment of this objective. The third one was to implement a pharmaceutical services guideline on immunization. The fourth one was to determine the impact of the national coverage rate of the influenza vaccine in the private community pharmacy. And the fifth is to contribute to the improvement of the nominal vaccination system of the Ministry of Health to facilitate its use by pharmacists. And as you can see, it is a big project related with so many things that we can be working around the immunization. But many of the actions were focused to attend the pandemic, to attend all the things that we have faced through the misinformation, through the response. And was, as one of our colleagues just said, nobody had predicted that we were going to face a pandemic in 2020. But this is an example on how we transform an initiative to respond properly to one thing that changed our lives. And I don't know, I think that I have just passed my 5 minutes, but there are so many things. We are still in progress. We have developed 9 webinars and we are still working. And I just want to conclude with one idea, just one idea, is that pandemic has brought us many lessons, but also many opportunities to encourage and to advocate for the pharmacists and the work that we can do in primary healthcare. So, Farah, thank you very much.
Thank you so much, Sophia. It was a pleasure to listen to your exciting presentation, and it's indeed inspiring to hear about the development of pharmaceutical services in immunization and how the pandemic contributed to pharmacists' involvement in public health and primary healthcare in Costa Rica. So we will hear more about this from our next member organization from India. It's a pleasure to introduce Dr. Roop N. Gupta. He's the chairman, Hospital Pharmacy Division and Vice President, presenting on behalf of the Indian Pharmaceutical Association. Dr. Gupta, the floor is yours.
Good afternoon.
Dr.
I am thankful to
Go ahead.
FIP for giving us opportunity to speak about the role played by our Indian Pharmaceutical Association in this COVID-19. When it was started in the March 20, we have drawn a strategy as per the WHO guidelines and our Indian government health department. First of all, we have made awareness program to inform all the masses. We have arranged program through town and different city, town, villages, and we have informed all public to prevent the spread of COVID in the people. So we have made awareness program, use of sanitizer, mask, hand washing, like that. Then we have drawn a strategy. We have drawn a strategy to maintain the proper supply of medicine. We see there are 4 categories of our pharmacists: community pharmacists, hospital pharmacists, and the pharmacists engaged in the manufacture of drugs, and also quality control pharmacists and our regulatory pharmacists. All played important role. Our community pharmacists, they have opened their pharmacy for supply of drug to the masses, and they maintain the stock of the drug which is required for the COVID as per the guidelines of WHO and our Indian Health Department. Then our hospital pharmacists in their hospital, they maintain 24 hours their dispensing of drug. They have stored the drug so that there should not be any inventory zero. At the same time, they maintain the proper stock of drug so that the hospital pharmacies, there should not be any shortage of drug. And community pharmacy, hospital pharmacies maintain the role for 24 hours. Then our manufacturing pharmacists in the hospital, next slide please, in the hospital, in the drug industry, continuous, we have maintained the manufacture of drug. You see, that time lockdown was there. There was very difficult to maintain drug. That time our regulatory pharmacists working in the drug control, they have maintained that the supply of raw material, packing material, excipients, everything should be supplied without hindrance in the transit because there was lockdown. And the manufacturing was maintained, our manufacturing pharmacists and quality control pharmacists, so that quality drugs were supplied and the quantity in each of the hospital, in each of the primary center, in each of the pharmacy, retail pharmacy, the supply should be maintained. It was ensured by our drug control officers, pharmacists. Then in this next slide, in this COVID era, we have also maintained the prevention of this by the vaccination. Our manufacturing pharmacists, they have maintained this manufacture of COVID vaccine. In India, Covishield and Covishield, two vaccines were prepared in our country. That was Covaxin and Covishield. We have maintained until today. We have given the injection of dose of by our pharmacists 2020 crores of people. Dose has been vaccinated to people. This was due to our pharmacists. And you see, India has thickly populated 140 crores of population, and we have maintained the spread of COVID disease, and we have controlled the people also. But there are what's happened since we pharmacists were the warrior. Government has given name as a frontline warrior, COVID warrior. Our pharmacists, some of pharmacists were engaged in direct contact of people. You see, hospital and dispensing pharmacists, retail pharmacists, community pharmacists were in the direct contact. So some of our pharmacists have lost their life. We pay homage to them. And due to this, our role played by pharmacists in this COVID era, government and also public has recognized the service of our pharmacists. The main pharmacist services in the role, which was not so much got recognition, but due to this COVID era, we have got recognition of our pharmacists in our country also. And we pharmacists have contributed to the healthcare of people. So in conclusion, I will say that due to this COVID era, we have learned how to control in this pandemic. So now we are prepared next time if any emergency occurs, if any pandemic occurs, we from our Indian Pharmaceutical Association would be able to control and would be able to provide our better pharmacy services to the masses. Thank you, sir. We have in this short period, because we have provided only 3 or 4 slides, we have tried to inform about the role of our pharmacists to the masses, what we have done in control of this COVID in our era. And now we are prepared to face any pandemic if any occurs. Thank you all.
Thank you so much for that, Dr. Gupta. Thanks to these services and being on the front line, pharmacists have become indeed the COVID warriors. Thank you for sharing your initiatives with us. And following on these initiatives from South Africa, Portugal, Costa Rica, and India, we will now turn our attention to the leadership organization from Ireland. And I would like to warmly welcome Claire Fritzel, Head of Professional Services at the Irish Pharmacy Union. Today, Claire will present Ireland's initiative to provide and administer COVID-19 vaccinations in community pharmacies and provide reliable health promotion information on available vaccinations. Claire, the floor is yours.
Thank you very much, Farah, and hello to all the colleagues out there. I think 1,000 days ago, I remember standing in this very office and hearing that Ireland was about to shut down, and it still brings goose pimples to my skin to think back to that moment. If you'd go to the next slide, please, Farah, maybe, and again, the next slide, please. Just to kind of bring you up to date into Ireland, we've about 5 million population, very much like Costa Rica we heard about there. And pharmacy is probably the most accessible healthcare professional in Ireland. At the top of my slide there, you see trusted healthcare professional. Throughout the pandemic, and it makes me very proud to be a pharmacist in Ireland, very much like Dara said earlier on, throughout the pandemic, pharmacists were the most trusted healthcare professional as independent research was done with the Irish population. So in terms of the role that pharmacists played during the pandemic in Ireland, we were pivotal. And I'm very proud of all of my community pharmacists and pharmacies that have really tried to deliver patient care. So in Ireland, we have about just less than 2,000 community pharmacies, and we have about 4,500 community pharmacists. And next slide, please. In that day, 1,000 days ago, we had to change our strategy as an organization overnight. And as part of that, we said, what is key for us in this? And it was really to support our pharmacists and our pharmacies out there who remained open throughout the pandemic. They never closed in Ireland. And in doing that, we really were keen of providing them with the accurate, reliable information, and also just so they could concentrate on what was doing what they did the best of, which is providing support to our citizens in Ireland. And you remember back to that time when there was so much information going on that actually a pharmacist working in their community, it was very difficult to understand what was real and what was fact to fiction. So in terms of what we did to support our members, it was on 5 pillars. So a clinical information resource, preventing infection control resource, preparedness and community plans, and also how we were quite reactive to our external stakeholders, and then in terms of the recovery plan afterwards. Next slide, please. So I just want to give you a flavour of what our organisation did, and I think it's quite similar to a lot of other organisations. So in terms of clinical information resource, quite a lot of it was, there was quite a lot of misinformation at the start of the pandemic, and we spent a lot of time making sure that the pharmacists in their communities were aware of the accurate information so that they could pass on that resource to their members. We also wrote a series of articles about the vaccine. So all the way along, our members knew what was happening about the development, so they could inform the members of the public who were coming into the pharmacy to ask. And we ran a series of talks around infection control and ideas like that to make sure our pharmacists were aware of everything they needed to do to be able to run their pharmacy safely. In terms of prevention infection control, and this is an important point for us as an organisation through the pandemic, was working collaboratively with other stakeholders. So we would have had a joint guidance document with our health protection agency, and that was important that we work together so they understand the environment of a community pharmacy and how we could best practice to keep all of our members of our staff safe. Very much like in Africa, we also got a license from our Department of Agriculture to produce hand sanitizers, and that was important at the initial stages when no hand sanitizers were left. We obviously had contingency plans and worked with our members to help support them in understanding what they could do to minimize the risk of spread within their workforce, as well as working on COVID-19 regulations that allowed pharmacists to now receive prescriptions by electronic means rather than just paper means, and also on testing services very much like Portugal, and digital certificate production that allow people to travel around Europe. And then very much what the end of our work would have been concentrating on was supporting our members, which through some really tough times and actually mental health supports, it became, increasingly as the pandemic weared on, actually supporting the mental health of our practitioners out in practice became more of our focus. Next slide, please. Just briefly to touch on the COVID-19 vaccination program, because I know Dara did so. One of the key initiatives we were trying to establish was that we would, throughout our vaccination program, up until this point, our vaccination data was not linked to the national vaccination programs. And during the preparation stages, when there wasn't enough vaccines available in Ireland to have a nationwide vaccination service, we worked with our health agency, the HSE, to develop a new system so that our vaccination records in the pharmacy linked into the national system. And on the slide there, that is the HSE PharmaFac system. To date, we've delivered over 1.2 million vaccines, and we're now, as Dara said, co-administrating the influenza vaccine and the COVID-19 vaccination program. But I just want to finish on the last slide, just to give some lessons in terms of or learnings for people. So I have at the top of that slide, good external relations that were invaluable. I can't overemphasize that in terms of any membership organizations out there listening. It was the power of relationships that got things done in the COVID-19 pandemic, and also now the maintenance of those relationships is helping us explore other areas for pharmacy in Ireland anyway. Also, to highlight the importance of high quality data and patient demographics in your systems within your community pharmacies. That was one of the key difficulties we had in terms of us getting to vaccinate populations. We could not, at pharmacy level and communities in Ireland, be able to differentiate different risk groups. And again, we're working on different schemes now to be able to identify different risk groups of patients. And then also just to highlight the importance of interoperability of systems and system resilience. That is something we've learned we need to do. We've done a good job in Ireland, but we need to do better on. And then two final points is the importance of practitioner health. Although the pandemic has receded in such, actually practitioner health and actually our population health and their mental health on the back of the COVID-19 pandemic is still a focus. And just to reiterate again, Farah, before I finish, that the key to, I think, the success of pharmacists in Ireland has been that collaboration with external stakeholders. Thank you very much, colleagues.
Thank you so much, Claire, for sharing the valuable success stories, but also the initiatives of our pharmacists in Ireland and describing some of the important lessons learned. I just want to remind everyone that in Ireland, there have been over 1.2 million COVID-19 vaccinations administered in community pharmacies, and with this number, of course, continuing to rise. So now it's my pleasure to introduce our speakers who will be speaking on behalf of the Japan Pharmaceutical Association, the leading pharmaceutical organization in Japan, Nobuo Yamamoto, the president, and Atsushi Tsuyomo, the executive director. In their presentation, they will discuss pharmacy's response to COVID-19 in Japan and their role in medication guidance during this time. Nobuo and Atsushi, the floor is yours.
Thank you, Farah.
Thank you very much. Thank you very much, and Hala. So my name is Yamamoto, and tonight, my younger colleague had Atsushi presentations to the Japanese situation. Please speak start and Atsushi.
Thank you. Good day, all colleagues. I'd like to thank you for giving me the chance to speak here today. In Japan, as in other countries, as infections spread, many people were worried about getting infected when they visited hospitals, and fewer people actually visited hospitals and pharmacies. In addition, as number of cases continues to rise, it is not possible to isolate everyone in a hospital, and those at low risk of severe illness are advised to treat at home. Pharmacies and pharmacists played a major role in helping these people continue their medication therapy. Restrictions on online medication instruction have been greatly relaxed. Online medication instruction can now be delivered by phone only, even without video. Also, after the patient instruction, the staff members who took measures to prevent infection delivered the medicines to the patient's homes, and many patients expressed their gratitude. Our efforts are helping to ensure that the public continues to receive medication, while at the same time providing home medication for those infected with COVID-19. Next slide, please. Go back one. Thank you. Next. Yes. Vaccination in Japan started later than in other countries. Under the government policy of aiming for 1 million vaccinations per day, the policy was achieved by each medical profession playing its own role. Pharmacists were sent to mass vaccination sites led by the local pharmacists association and played a major role in vaccine dilution dispensing and consultation services. Vaccination by pharmacists is not permitted in Japan, but at present, the techniques of vaccination are being taught in pharmaceutical education, and training is being conducted nationwide based on the curriculum established by JPA in preparation for the next outbreak. Thank you for your attention.
Thank you so much for that, Atsushi. Okay, so as we move on from Japan, we will now present the experience of pharmacists in Lebanon and the initiative of the National Institute of Public Health, Clinical Epidemiology and Toxicology, Lebanon. The initiative is COVID-19 and the economic crisis, and I'm pleased to introduce Dr. Hala Saqir, Chief Executive Officer and the co-founder of this member organization. Dr. Hala, the floor is yours.
Thank you very much. Thank you, FIT for the support and for inviting me to be part of this panel to share the experience of Inspect LB, a non-profit autonomous research group of more than 30 multidisciplinary researchers and academics. Next, please. Inspect was established. Next, please, Farah. Okay, Inspect was established in January 2018 and has now more than 500 published papers in peer-reviewed journals. It also has several local and international collaborations, and recently we have been collaborating with the Order of Pharmacists of Lebanon on a competency framework for pharmacists from all the sectors of the profession. Next, please. Okay, during the pandemic, Inspect did what it knows best, that is research. It dedicated part of its work to develop health education materials to the general population and guidance documents for healthcare professionals in 3 languages, Arabic for the general population and English and French for professionals. It also participated in national committees related to COVID-19 surveillance and vaccination at the invitation of health authorities and academia. Next, please. Okay. The lack of a national strategy and guidance for emergencies was the main driver behind our initiative. The daily figures published by the Ministry of Public Health were merely informative, and no actions have been taken to anticipate the problem instead of waiting for it to happen. That was the problem, actually. And when it happened, lockdowns were imposed. Okay, we know that lockdowns were very important, but they have deepened the existing economic decline in Lebanon. During this period, you also experienced severe drug shortages, which were expected to affect the morbidity and mortality of infectious and chronic disease patients. Next, please. Currently, we have, next. Okay. We have several projects that are still ongoing, and we have more than 50 published papers in peer-reviewed journals. I mean here published papers about COVID. And Inspect LB is actively leading on the development of a national pharmaceutical strategy in collaboration with the Order of Pharmacists of Lebanon and other stakeholders. And the team is also working on 2 additional strategies, one for pharmacy education and workforce, and one related to pharmaceutical research. Next, please. During our journey, we faced several barriers. Next. No, excuse me. Back one. I didn't see it. Back one. No, one back, please.
Sorry, Dr. Hala, do you want us to go to the impact slide or?
No, to the challenges slide.
To the challenges. Very good.
Yes, this is it. Okay. The first challenge was related to data collection. It was a bit difficult and people were reluctant to participate, probably because of the overwhelming crisis. The collaboration with health professionals other than pharmacists was also difficult, probably also because of lack of time, conflicting interests, and competitive attitudes. The last obstacle was related to health authorities. Access to COVID-19 surveillance data was restricted by the Ministry of Public Health, and competition between relevant authorities made it challenging to implement recommendations and suggested plans. The lessons learned, next, please. The most important lesson is that relevant authorities should have implemented strategic thinking for a better response to emergencies. One more important idea is the collaboration culture. Competitive attitudes did not serve the objective of fighting COVID-19. However, we at Inspect LV kept hoping, despite the challenging context. We have developed a comprehensive, ready-to-implement strategy, and we submitted it to the relevant health and education authorities, hoping to make the impossible possible again. Thank you very much.
Thank you so much for that, Dr. Hala, and thank you for reminding us.
I promised you I will not exceed 5 minutes, and I guess I only did 4. Thank you very much.
Thank you for that. And thank you also for reminding us about the importance of research and how it's important to produce evidence regarding our current situation and the evidence of impact. Once again, thank you for the excellent presentation.
Thank you.
I'll move us forward now to another case study from our Malaysian Pharmaceutical Society, Malaysian Pharmacists Association. Dr. Jacques Chen Lim, who's the treasurer, and he will address the pharmacist's role as vaccine administrators and the certified training on immunization for pharmacists. Jack, the floor is yours.
Hi, thank you, Farah. Just a minor correction. I'm Mr. I'm just Jack, call me Jack, and I represent the Malaysian Pharmacists Society, MPS. So basically what happens is our experience with COVID, because it happened quite suddenly, although we have a bit of warning that it happened in our backyard in China. And we started getting issues and news and concerns with regards to the disease quite early on. So essentially what happens is that throughout the last 1,000 days, our journey has been divided into a block of days, something similar to what FIP has given us. So along the way, the society representing the profession actually reacted differently. On the next slide, I will be talking about the strategy that we employed. No, just go back first. Not yet. The next slide, I will talk about the strategy that's involved. But at this moment, based on the 100-day blocks that we have, the first 100 days essentially when we started in March 2020 with the lockdown, and as well as what happens is that the Ministry of Health started kicking into gear about the concern of exposure to COVID. Our first issue that we had was the recognition of pharmacists as a frontline health worker. So this is the first thing MPS has, the first challenge that we have to deal with, because we were not initially included in the frontliners. So when the lockdown came, people that are doctors and nurses, and even our colleagues that actually work in the Ministry of Health have no issues going to work. But the community pharmacies, with the community pharmacies and the communities that we serve, we actually didn't have that recognition. So there were problems, there were roadblocks, there were issues moving around when the lockdown came. And because we have a very strict lockdown in the beginning, we can't go beyond a certain distance, and we cannot cross borders, even district borders within Kuala Lumpur, our capital city. Then because of that, we have challenges of our staff moving along and on all that. So that recognition was the first step that we went for. And immediately after that, we went to protect the pharmacists, right? Because there were also shortages of PPEs and equipment as well. So MPS took the step to actually get procure and distribute masks to community pharmacies so that we can actually keep community pharmacies open. I'm happy to report to FIP as many other countries, our pharmacies stand firm. We didn't refuse to be ignored. We refused to we didn't even close our pharmacies and remain open. And at the same time, we also adopted guidelines immediately within the 100 days. Then that we move on to educate the public, mask wearing, what are the conditions that we need to deal with, hand washing, social distancing, all this comes in. And we also explain to our communities why the SOPs are required, and it goes on. And after that, when the vaccine started coming out, we had another problem. Again, pharmacists were not included in the initial vaccination list, not to administer, but to receive the vaccine. And through the effort of all the pharmacists and also, as well as MPS, we managed to get that through, and we became part of the first to get vaccinated. And this continued on. We had ivermectin, all different things and treatments that comes in, and we have to deal with that. And that was when we started advocating vaccination and moving on. Then recently, in the last year, we started dealing the new normal. We are talking about testing, self-testing when you go out, testing when you go for events, and so on and so forth. And now we are in the phase of continued preparedness. Okay, next slide, please. And with regards to the strategy, the initial strategy that we immediately launched into as a society was we started moving everything online. Okay, so basically our meetings went online, our discussions went online, our staff went online, and on top of that, we started doing webinars, and we shifted very quickly to provide information online. Then our pharmacists, through their own initiatives and also with their local area committees and our MPS chapters and other pharmacist associated societies, started providing information to the public. We have webinars, we have snippets, we have TikTok, right, that went out about how you wear a mask, what's the difference between a face mask and a cloth mask, surgery mask and a cloth mask, and so on and so forth. Then at the same time, we make sure that pharmacists are protected. We were given guidelines thanks to FIP and FAPA, adopting the best practices that we received from the two societies and the regional and the international organizations, and then we disseminate it to all our community pharmacists and pharmacists, and as well as including us as national COVID vaccination as frontliners. And on top of that, we also engaged the public. We were up in the forefront. The pharmacists were there when we talk about ivermectin, about different so-called different treatments, inverted commas, that you can do with COVID. And a lot of this information was out there. Even when the vaccine came, the anti-vaxxers and also all this, and pharmacists were there in the communities and online, wherever we are needed, we are there to actually present the facts and highlighting it. So I know I'm a bit over time. I will just spend the last minute, another minute, to talk about the initiative that we submitted. Actually, this is actually an interesting initiative that MPS, the society, worked with USM, the basically Malaysian Science University, where we have the oldest and the most established pharmacy program in the country. Although I'm not an alumni, my dad is also a pharmacist and an alumni of USM, and we work with them to come up with a certified training program of immunization of pharmacists, and essentially this is actually a program to equip pharmacists to actually prepare to be vaccinated and to administer vaccines. We are already advocates of vaccines, as highlighted. We were already sharing education. And essentially, the drivers and the motivators is the motivation is to actually get this training to be done, even though we do not have the right to administer vaccines. Although that did came a little bit later when not only MPS, but other associations and societies for pharmacists in Malaysia went out and we engaged Ministry of Health, and we were engaged the pharmacists and the public as well to actually get us as listed as part of administrators of vaccines. And on top of that, and the current status is ongoing. The government has included pharmacists. We are part of the national program when they were doing all the major mass vaccination. The thing about it is that the question remains whether we can get this off into a private setting and continue to vaccinate, and also to deal with other vaccines for adults, such as your pneumococcal and your influenza vaccines, or even COVID vaccines as it becomes more normal. And the impact is that, yeah, we can vaccinate under specific conditions. Challenge is limited. There are legal considerations that we need to deal with. We have indemnity and also the recognition. And the lesson for this, for us, is that we need to increase preparedness. And we really appreciate FIP for continuing this journey to continue to keep us prepared for the next and the next and the next. And at the same time, we need to improve the environment and the recognition of the role that the pharmacists play as advocates and administrators of vaccines. And this is where one of the lessons is we actually need to engage with FIP, FAPA, and even WPPF more and bring them into the conversation so we can actually keep this going. We have gained a lot. Pharmacists have gained during the COVID pandemic. Now is a time for us to safeguard what we have gained and continue to expand what we can do. Thank you very much. Back to you, Farah.
Thank you so much for sharing, Jacques, and congratulations to MPS. Just to note Catherine's comment in the chat box for you, please do get in touch with our lead for provision and partnerships, as this will be great to be available for all of our member organizations. We improve our preparedness and empower the work of our member organizations by working together. So moving forward, I will now invite our next member organization from Malta, Marianne Sant-Fournier from the Malta Chamber of Pharmacists. She's the president, and she will talk about the paperless dispensing and collaborative prescribing initiative. Marianne, the floor is yours.
Hello, thank you very much for that. Can you see me?
Yes, we can see you. Go ahead.
All right, so first of all, thank you again. I must say that the Maltese pharmacists and the Malta Chamber shares most of the initiatives at different levels, of course, with regards to what has been reported, and there is a full report in the in our submission to the FIP report that was just launched. However, FIP invited the chamber to present a specific case, which is this paperless collaborative repeat prescribing and dispensing in the POIC scenario. Of course, I must start with the fact that in March 2020, we had the first recorded COVID-19 case. And of course, it was an unmapped scenario, but we were looking at what was happening around us and of course, what our affiliate organizations, so FIP, was advising, etc. And so our policy was to immediately respond to lead, because the members were looking up to us, and also to offer guidance, direction, and support of all pharmacists, especially the community pharmacists who, like our colleagues elsewhere around the globe, were frontline pharmacists and had also to fight for that recognition. But during there was a partial lockdown and further on, but pharmacists were considered as essential service and did not close. And so our focus was specifically on community pharmacists to give that support. The objective of our policy was to maintain seamless, uninterrupted pharmaceutical services to patients, including access to medicines, especially the more than 140,000 patients which are registered with the pharmacies of their choice within the NHS POIC scheme. We also, of course, worked on safety protocols and other aspects in order to ensure personal, client and patient safety, physical and infrastructural protocols, health and safety, and also professional practice guidelines. We did work with our Superintendency of Public Health, the Medicines Authority, the Public Health Service, and also the primary health care. Next slide, please. And of course, next slide. Of course, because we are speaking in the context of the 4-year anniversary of the Astana Declaration, which focuses so specifically on primary health care and the critical role of pharmacy in primary health care with regards to COVID-19 preparedness, and also the importance of the resilience of pharmacy and health systems. I am presenting now this specific case, which is a result actually not only of the chamber leadership in this matter, but also with maybe in terms of what Dara said earlier on, the primary healthcare coming to pharmacy. I think I can explain it in that way. So the motivation was, of course, to ensure seamless access to medicines and medical devices for chronic conditions within the pharmacy of your choice scheme, which actually registers pharmacy with the, registers entitled chronic patients with the pharmacy of their choice in the towns and villages of Malta. This was to ensure continuity of treatment and also to reduce the revolving door syndrome at the main hospitals during the pandemic. It was also a compensation of the family doctor and consultant services in the private sector because there was a deficit in the community because the doctors weren't providing their usual clinic services, and also access to consultants. So there was a convergence in the recognition of pharmacists' value, expertise, and professionalism, both by the chamber leadership, we had no doubt of that, of course, but also of the health authorities and healthcare professional colleagues, lead colleagues. The pharmacy profession's rise to the occasion, proof of resilient profession, immediately responsive and adaptive to change, as expected. And also another important motivation is the Carpe Diem principle, applied to a coveted authority as a development in pharmaceutical care practice. Next slide, please. Okay, so this is a simple diagram which shows the relationships, or as from the aspect of the primary healthcare system. So we had the primary healthcare department, the psychiatry community services, and the clinical chair of psychiatry, together with the POIC unit and the chamber, the Malta Medicines Authority, all converging together to spearhead paperless dispensing and collaborative prescribing. We are talking of repeat prescribing and dispensing. Next slide, please. So in more detail, of course, the chamber in consultation with the various health authorities, the consultant lead psychiatrist, community services and chairperson, quality safety standards committee, Department of Psychiatry and clinical chairman, psychiatry department, and the Ministry of Health, directed pharmacists together, offering a POIC service to repeat dispense the medicines that registered patients were entitled to, and whose POIC medication records were accessible on the POIC web-based pharmacy dispensing system. This effectively presented the medication record, the medication records of the registered patient, and so on the strength of that, the pharmacist had a protocol which the chamber devised and was approved by the authorities, and also an SOP which was specific for psychiatric health patients. This evidence effectively eliminated the necessity for a repeat prescription by a consultant or family doctor, reducing, of course, document handling to a minimum to diminish contagion and streamline the repeat dispensing service. Of course, the service was born from the objective to minimize contagion, so to go paperless. However, with time, it was noted that this was an authority that we actually craved, so Carpe Diem, where the prescription was deemed to be necessary, an email with a photo or a scanned copy of a prescription was preferred. You must understand that then a full-blown electronic prescribing system is not yet in place. However, electronic prescriptions are some are available to an extent, and those are of course welcome. We also accepted WhatsApp photographs, for example, because WhatsApp is encrypted. In that context, though, so over the months in 2021, the protocol was updated, and this provided for patient referral by pharmacist to doctor if the patient reported changes to symptoms in response to pharmacist questions. So the updated protocol urged pharmacists to ask questions so that then they could identify those patients which were at risk and which required a referral to a doctor. And so the protocol was adapted to accommodate that. Next slide, please. So the result was that there was no interruption of pharmaceutical care services throughout the pandemic. Repeat collaborative prescribing and dispensing supported by the POIC digital platform is an acquired authority now. And the lessons learned are that there is a reaffirmation of the Chamber's leadership role in supporting pharmacies in times of crisis. A new role of repeat collaborative dispensing and prescribing attests to the pharmacist's competency and, if I may add, also resilience. Pharmacists have proven that they are resilient, in fact, under the constraints and challenges of the COVID-19 pandemic. Under the guidance of the Chamber, they have taken the necessary measures and retained and mandated their practice without interruptions to the pharmaceutical services to the community in a time of need. As a note, we refer to this case study project, if you wish, work in progress, because we are collaborating with the primary healthcare doctors, and also we are hoping to collaborate with the private family doctors so that we can fine-tune the referral protocol and render it effective. Thank you.
Thank you so much, Marianne. So given the time we have, I will move us to our last member organization case study, and I'm pleased to introduce Leonor Suarez, the International Affairs for the Portuguese Pharmaceutical Society. Leonor, the floor is yours.
Hello, everyone. Thank you so much for having us. So as Farah said, I'm Leonor, and I'm the International Affairs Lead at the Portuguese Pharmaceutical Society. The Portuguese Pharmaceutical Society is the body that regulates the pharmaceutical profession in Portugal, and we represent over 15,000 pharmacists in Portugal. Next slide, please. After the WHO declared on the 11th of March of 2020 COVID-19 as a pandemic, the Portuguese Pharmaceutical Society, in partnership with other sectorial associations, created a help desk. As you can see, we collaborated with the National Association of Pharmacists, with the Portuguese Association of Clinical Analysts, other patient organizations, students, and so on. Our involvement, next slide, please. Our involvement was through our specialty boards, of community pharmacy, specialty board of hospital pharmacy, and the specialty board of clinical analysis. And basically, these specialty boards were in charge of liaise with their areas of practice, and they were also responsible to liaise with sectoral associations in providing and elaborating contingency plans for each practice area, to also elaborate technical information and guidelines, checklists for professional interventions, and also to elaborate informative materials not only for professionals but also for citizens. Next slide. In the scope of this help desk, we also created a free helpline with the aim of supporting pharmacists. All support was given by pharmacists with specific training on this subject. And between 9 a.m. and 7 p.m., we were answering questions from community pharmacists, all questions regarding technical or scientific matters regarding COVID-19 and COVID-19 questions. And after 7 p.m., we were focusing our answers to hospital pharmacists and clinical analysts. This helpline began on the 16th of March and was organically absorbed by our Medical Information Center, which is a service that we were already providing before the COVID-19 pandemic. And our colleagues are still answering to questions regarding COVID-19. We also still share with our members information about COVID-19 when needed. So this helpline has stopped as it began in the was in the beginning, but we still carry this information flow and sharing information about COVID-19. We also created a volunteers database. This volunteers database comprised pharmacists and last year's pharmacy students, and they were also working closely with both the hospital pharmacy teams and the pharmacist helpline. So basically, these 3 projects I presented were to support our members and to support pharmacists to make sure they had all the information and they had all the skills and the competences to keep providing a good service to our citizens and patients. Thank you.
Yes, yes.
Thank you so much for that, Leonor, and thank you to all of our speakers for joining us today and for sharing these important initiatives. Of course, as we mentioned in the chat box, we encourage you to refer to the report for more information. But for now, I'll hand it over to my colleague, Shirley. Shirley, over to you.
Thank you so much, Farah. I know that we are running out of time, so I will be quick. So one part of the report, it's about the leadership strategies and initiative, which we already heard some case study today, which is really good. And member organization, they share their responses, and I would like to congratulate them as well. And thank you so much for sharing the initiative. And now I will share about the global survey on pharmacy response to the pandemic, and more detail is actually in the report, which I will encourage you all to read through it later after this event. So let me just go through them quickly. A little bit about how we collect the data. So it's basically we distributed an online questionnaire on October 2021 till February 2022 to all of our member organizations. Invite them to answer to our questionnaire. It's basically we ask them about their initiative, their activities, and their outputs throughout the pandemic per 100 days. And we also invite them to answer question about the role of pharmacists during the COVID-19 pandemic, and also about the main challenges, priorities, and support. And the data actually that we have a total of 52 member organizations. So thank you so much for all member organizations who contributed to this survey across 44 countries. And this map is basically just show about the distribution across regions. So we have everything in the region, and we will upload the information through our Sustainability RX microsite that Lina previously also shared. So I will go through the result a little bit quick, and I know that you all can also see it later in the report. So we have like kinds of like general themes of the activities per 100 days, which you can also read through it in the report. But just a note, basically, that the themes is actually varied across member organizations, but hopefully this will provide a general idea about what member organization did from the beginning, from the 30 January 2020 until 700 days. So I will encourage you to read through the report later on. And in addition to the category across 100 days, we also categorize the themes according by looking at the initiative, and we come up with 11 categories on what member organization have done throughout the pandemic. So the first one is provided clinical guidance to support pharmacy workforce in managing COVID-19, and this actually something that come up as well today in the share case study by our member organization in Portugal and Malta. And the second one is also to do public educational programs and events, and this is also mentioned by Malaysian Pharmaceutical Society as well today. And the other one is also the third theme is also about conducting a digital events and educational program. And this is also conducted in collaboration together with the other healthcare professionals as well. And also to support the members, and this mostly mentioned by all of the member organization. And the next themes that come up is collaboration with government and local authorities. And the next one is facilitation of COVID-19 logistics and medication supply, which actually our member organization from South Africa mentioned about this as well earlier. And the next theme that come up is to support pharmacy and pharmacists to perform COVID-19 diagnostic testing and also to administer COVID-19 vaccine. And we heard about that as well today from our member organization from Ireland, from Portugal, from Malaysia as well. And we also, most common things that member organization conducted is also training and development of pharmacy workforce, followed by also doing science and research, which heavily mentioned by our member organization from Lebanon today, and also being involved in the law, policies, and regulation. And last theme is about the development of digital tools and website. And I would like to encourage you all to read through the report to look at more detail about the activities according to the member organizations. And that's more or less about the result of the global survey, and I would like now to give the floor to my colleagues back to Lina to present briefly about FIP response to COVID-19. Lina, the floor is yours.
Thank you, Charlene. We are really nearing the end of this, but I want to reflect and say we are so proud of the leadership displayed by our member organizations. So much to learn from and be proud of. We are nearing the end, but before we nearly close, I just wanted to give you an overview of the summary of the response areas and themes that FIP had done for our members during COVID. Charlie, can you go to the next slide, please? And this will be animated, so please click on, but these summarize our response areas. So throughout everything we've done, these have been the underpinning guiding principles, if you want. Throughout COVID, we have been ensuring that we are supporting international solidarity in our members. This is at the heart of everything we do and have done and continue to do and deliver. Advocating and showcasing the impact of the profession in responding to the pandemic. We have continued to gather data, evidence, and innovation, and this report and some of the case studies displayed today is one such example. And throughout, of course, always adapting our business and ways of working to respond to the needs of this very particular set of circumstances. These underpin 10 themes that are described in detail in the report. The next slide lists these themes, and I just wanted to run them through you. So you'll see a very detailed description of each of these themes in the report. One was creating a global knowledge base, a FIP COVID-19 hub that's available for all, a resource center for COVID-19, but also other emerging emergencies and pandemics. We have gathered global expertise, and we describe this through the work of the FIP COVID-19 Expert Advisory Group and the task force preceding that. We established the FIP Pandemic Preparedness Program in response to the pandemic, strengthening FIP advocacy for pharmacy-based vaccination delivery. We've only strengthened our work on this very existing and important piece of program for us, and you'll see a summary of some of the key highlights of work we've accelerated in the last couple of years. Supporting the workforce with professional and technical guidance, and you'll see details of the guidance and resources we've developed. Gathering data, evidence, and best practices. That includes also surveys, case study gathering, and details on those and the results and where you can find them are also in the report. We also describe how, as an organization, we've had to adapt our own ways of working in terms of staff and offices, and even adjusting completely, in some cases, our business plans and programs. These are also described. We've redesigned our membership engagement strategy to be fitting for a more virtual engagement approach. So that's also described, and we continue to deliver that, of course. Throughout the pandemic, we've continued to strengthen our partnerships and prioritized working with others. We have prioritized collaboration during these difficult times. And last but not least, we have also delivered bespoke COVID-19 digital programs annually every year since 2020, and Noor will very, very briefly give you a couple of lines about each and remind you of the link to where all of these events are free for all. Noor, over to you.
Thank you very much, Lina. So very quickly, I'd like to give a quick and short summary of the 3 series of digital events that FIP has launched each year since the start of the pandemic, and share some of the lessons that emerged along the way. In the first series, which consists of 43 digital events, we aim to identify successful methods and strategies through which pharmacists can contribute to the control, prevention, and treatment of COVID-19. And some of the lessons learned from these events include the importance of managing, training, and developing the pharmaceutical workforce during pandemics, the significance of the mental health of our workforce and patients, and to always make it a priority, pharmacy education and the challenges that pharmacy students faced with the shift to remote or online learning. And of course, learnings from different countries across all these areas were explored in this first series. Next slide, please. In the second series, launched in 2021 and which consists of 13 digital events, we looked into what had gone well during the first year of the pandemic and what areas still required work and improvement. And these areas include integrating pandemic preparedness and response as part of pharmacy education, for example, and a clear understanding of the effects of different drugs on the virus and the disease it causes, and the significance of increasing access to vaccines by involving pharmacists in vaccinations and as a way of disease control and prevention. So in summary, the second series moves us forward by assessing the learnings from the year before and using them to inform the third series to move ahead with the battle against the pandemic. So in the third ongoing series launched in 2022, events mainly focus on pharmacy preparedness for future pandemics. It moves us from the COVID-19 pandemic to the preparation of future ones to ensure we don't face the same issues we did in our battle against COVID-19. If you'd like to know more about these series and events, please visit our website, events.fip.org, where you can find all these series and webinars available for free. And thank you, Dina. Over to you.
Thank you. As the final stop shop for this event, another reminder about the report, we'll send the link through the chat. And I want to ask Catherine, who's been with us throughout the event, to please provide us with some closing reflections from you as CEO, but also some assurances about the continued work we will be delivering.
Of course, Lina. What a pleasure to be part of such a showcase of member organisations. I mean, really, this is splendid, and I really would promote this and make sure that everybody who has taken part today showcases this to their member organisation, to their members of their member organisation as well, so that everybody can have a chance to see the great work that they've been presenting today. So there's a couple of points I just wanted to mention in my closing remarks, and one is that we really had to join forces on this. Whilst everybody had to consider what their nation needed, what their patients and their populations and their pharmacists needed, FIP was here to showcase that for you and with you. There's no need for duplication. We can show and share your work on a global platform, and where you need us to step in and support you, that's exactly what we have done and will continue to do. It's a really important piece as well. I think, Jack, the point from Malaysia was really, really good, where you sort out good quality training. Now we can do that globally through the FIP seal. And all of that is now in place. And we think that where one organisation or provider has excellence to offer, this is a really good opportunity to share that more widely. And if you think about all of the work that we're doing for our primary healthcare, including non-communicable diseases, the prevention agenda, safety, issues around AMR, communicable diseases, the ways in which we're vaccinating, we're preventing those that have NCDs from suffering worse and worse impact from diseases like COVID. And even as we enter the flu season in the Northern Hemisphere and those in the Southern Hemisphere have exited, we can see that immunity is a really big issue across our communities as well. So there's lots and lots and lots for us to continue to share. Now, colleagues, of course, we will continue to share the stories. There will be many more hundreds of days before we're well and truly through the pandemic. And with our increased burden on our healthcare systems, we think this is really important. But as Lena mentioned, we have to provide a bit of a reflection opportunity, an opportunity to gather our practices and our lessons, and now we will build towards preparing for the next one. I fear saying that, Lena. It really fills me with trepidation when I say prepare for the next one. But as the adage goes, if you fail to prepare, prepare to fail. And one thing that COVID has taught us is that we can step up at any point in time to respond to a crisis. What would be even better, as and when our next crises come along, we're more prepared than ever. So we'll look to all of the examples we've seen today, everything else that we can gather from our member organisations, and we'll make sure that together we're prepared for the next steps. Thanks, Lena. Thanks to everybody involved. It makes me so super proud to be CEO of such a great federation when I see the work of our members, our member organisations, and of the team. Next slide, please, Lena. Seamlessly, to say a big thank you to the team. Lena, for your stewardship and leadership in this work. Shirley, Farah, Noor, Zeng, wonderful. And then, of course, everybody who's been involved in the events today, and of course, the wider team as well. Because as I mentioned, this work has had a touch point on every single person in the team. There's a couple of other thanks, all the member organisations. Without you, FIP is nothing. You really are our arms and legs into our countries. Ruben, thanks a million. Chris, for all the support from the survey and the observatory itself. Linam, for the input into the report, and the whole programme team, the regional account holders, and all of our officers in this work. We have to spend a special moment to say thank you to everyone who stood up and stepped in to the FIP COVID-19 task force, which then merged and evolved into our COVID Global Expert Advisory Group. That group will be disbanded in its current form, but will be reformed to support our work on pandemic preparedness and all of our work on planning for the next crises. We're also joining forces on this with all of our humanitarian work as well, because we can see so many countries have had their current situations worsened, and within the pandemic, further situations worsened as well. I think we had a really good testimony from Lebanon as one example of that. So colleagues, we really want to stand shoulder to shoulder with you in this work. We're really excited to see your great work. Let us showcase that and share that, and make sure that you ask of FIP what we can do for you. A huge thank you. Lena, over to you for the final closing remarks, and thanks a million.
I could not follow that with any better words, Catherine. Thank you so much. I'd like to thank everyone for being with us today. We appreciate you attending this event, participating in it, and we hope those listening in afterwards will also benefit. Just as a final remark, in the next slide, a reminder, please visit events.fit.org to view and listen to recordings from all our previous events, including the recording of today's event, which will be up there very soon. Thank you so much from the deep of our hearts. Thanks to the team, and we look forward to engaging with you in the future. Thank you so much.